always the question that people have is, how will I lose weight? How will I maintain weight? And more importantly, or most importantly, how do I prevent weight regain after I've worked so hard to lose this weight, whether it's with a diet and exercise alone, or if you've had a surgical procedure like a gastric sleeve or bypass or gastric banding procedure. That is, of course, our greatest interest. We know that all patients will lose some weight after one of the bariatric procedures, if only because they've had surgery and they've been laid off, or perhaps we can attribute it to sort of the novelty of the operation, or everybody sort of gets really more dedicated to fulfilling their New Year's resolution in January. But when February and March roll around, I think a lot of us slip back into the old habits again. The same is true with weight loss and food habits. So without a specific structure, without specific personnel within a practice that can not only educate but coach our patients along the way in a number of related issues, not just the food we eat, not just the macronutrients, but also the micronutrients, the vitamins and minerals. It's a lot of educational material, a lot of adult teaching, a lot of circling back around to make sure that people have got the message, reteaching again, coaching, helping people to put into practice things that they've learned. So it's not enough just to teach alone. We have to really be there with our coaches and our counselors. So it is expected that patients will get to a point in their weight loss where there is a plateau or a maintenance, and if that happens to be at the desired weight, where now an individual's happy at their present weight, or clothes fit better, or getting compliments from coworkers or family, then that's usually the place that somebody will stop. But monitoring and making sure we have adequate understanding of the nature of our physiology and how our metabolism is affected by what we eat, and how our metabolism is affected adversely by when we eat too much, or if we eat the wrong kinds of things, or if we have too much excess weight that's been gathered. So all of these things we will talk about and continue to educate and coach with our dietitians and our exercise physiologists and trainers, me, my mid-level staff, my entire staff. We're interested in your weight loss. So with all of those things, that's, I think, stands our best chance of being able to not only achieve a good weight for you, but also be able to understand what it takes to maintain that weight long term.